just treat the ear, auricular acupuncture, and this treating your ear for the whole body. Then what else? We also have hand acupuncture. Just put needle on your hand. It's a bit painful, okay, a bit painful. So I'm gonna show you something Zhu acupuncture today. Now Zhu acupuncture, this is how I've got needle over here. So Zhu acupuncture's needle scalp, right? So I'm gonna show you how the needle scalp, and it's very painless. And Zhu acupuncture particularly great for stroke patient. For pain's good too, for organs as well. If you go YouTube, you put Zhu acupuncture, you see how Dr. Zhu, Master Zhu, use that tiny needle the head, and get patient, patient have stroke and on wheelchair, and get them stand up straight away. That was amazing. In 2014, I actually organized it. I was the organizer, organized a workshop in Auckland, and get a lot of acupuncturists to join us to learn Zhu acupuncture. All right, now I'm going to show you one how I needle it. It's very painless, and guess what? I actually, my mom, my mom can needle herself with Zhu acupuncture technique, with that tiny needles. Okay, so I just want to show you how it's very simple. It's very, very simple. Okay, I actually taught my sister as well. So way back in China in the old time, when you learn acupuncture, you don't have to go to school. There's no university. Okay, it's always the dad or the mom teach the son or the daughter. So it passed from one generation to the next generation. You see what I mean? So over here, in this point, it treat the heat, the sinus, itchy eyes, sore ear, bowel palsy. That's treating here. Let me show you how to do that. If you bang something, that's not gonna go through your scalp, so it's very, very safe. And with scalp acupuncture, it only go through under the skin, very superficial, very superficial. Okay, let's have a look. Now on this on Facebook, here you go. Here you go. Second, normally you put one area, 3 needle on one area. Yeah, then we need to do some stimulation. If we like the beauty of scalp acupuncture is after needle I can still move. Okay, if I treating the stroke patient, we want to treat the shoulder, so we put on the shoulder area, basically about here. Then we ask the patient to move, or we help the patient to move, because the stroke patient, they might not be able to move themselves. So while they move, we stimulate needles like this. And very gentle. I can't even feel it, but I'm actually moving the needles a little bit. That's it. And what else? Balance method acupuncture come with scalp acupuncture as well. It's pretty similar to Zhu acupuncture, the image of it. Pretty similar. The beauty of the scalp acupuncture is I normally retain the needles to get patient that you can go home with the needle. But patient do sign a consent form. I let them know how they should manage the needles when they go home. First thing is, I said, well, I'm gonna leave some needle for you, and then they said, how long? I said, as long as you can go sleep with that. Because some patients, they need to manage the pain, they actually wait the needle for 24 hours. That's what we do in our clinic. It's and our patient wear this to the supermarket, and everyone look at it. It's acupuncture. It's a good advertising for us. The other thing is, I ask patient. They say, "Well, now go ahead and get your hand and can you feel the needle?" They say yes, and then pull it out, and they just take it like this. Is it alright for you? Yeah, it's easy. So patient just pull it up like this, and I just put it in for them. I said, that's it. You know how to pull out the needles now. Now you can come to work for me and be my assistant. It's a joking one. Okay. I have to. Can we do electric stimulation for age-related atrophy? Also, I have used the 220 for the patient, and I want to thank you by core of my heart for making a special video for thyroid for me. No problem. Yes, any condition. Is it one turn posterior to the hairline and half turn lateral? It doesn't mean whether it's half turn or one turn lateral to the side. It doesn't really matter. Depending on what your thinking is, whether the needle need to go to half turn, I can go through even more half longer than half turn, depending how much area you want to cover into it. Okay, that is fine too. So I get my patient to wear this in home and 24 hours, and then I don't ask them to stimulate needles, but I do ask them to like my patient, they go to do a physiotherapy. I say, well, it's great for you to do the physiotherapy when you do this, okay, because this actually decrease the pain, then you be able to do more movement for training. So this is great. I do a lot of for back pain if they have severe pain, and as I said, most of my patients and they come once a week for acupuncture and with herbs. So weigh some needle for them and they walk home. So in my practice, I actually combine a lot of technique together. So this is part of the Zhu Scalp Acupuncture as well as balance method acupuncture, scalp acupuncture as well. You see. So I really recommend. I just showing this video. It's actually on my Center of Balance platform. I really want my patient to understand what type of acupuncture we're doing, and you don't have to scare of scalp acupuncture. It's very safe, and I do it all the time. And you might be one of my patient, and you see that we did that for you as well. And if you what is your experience with scalp acupuncture? Are you scared with it? And you've been alright for it? Can you please leave some comment and under here and let us know, share the experience with on new client, new patient. No problem. Thank you so much, Sunan. You are so kind. Well, I always love to share, and because I think sharing is important. Sharing and so acupuncture in the Western world is not many people recognize that, but more and more people recognize it, and I have a lot of people tell me that, hey, you shouldn't show needle in front of the video and to the audience or to people. You see, have you seen the dentists? They never show how they pull out the teeth for patient for the public, because this is a bit scary and you're gonna scare off patient. I said, in my mind it's a bit different. Why is that? Because you shouldn't scare of acupuncture. Acupuncture is a very gentle one, and what we do in scalp acupuncture and balance method acupuncture and acupuncture spirit to treat your organ, they are very very gentle one. Apart from GE acupuncture, because GE acupuncture is a different thing. I use it to treat the structure thing, and structures you need the needle muscle, and it causes a bit of pain. It causes a bit of a strong sensation, but those are not going to kill you, and those are going to make you better. And I explain to my patient, this is going to be a bit more stimulation, and you will feel it. It may last for 1 or 2 days, or even though you can feel it sometimes because we use very very thin needles. So I just want to share, and remove your fear. You don't have to worry about needles. If you don't like needle, that's okay. You come in, we have other method that is no needles as well. Okay, Robin, well, is it ever consider letting acupuncture treatment for varicose veins, do you think? I don't know. Varicose veins is very difficult. I tried with acupuncture, Robin. To be honest, my acupuncture technique hasn't been able to target varicose veins very well, and I know some others they have this technique, but I just haven't got to it. I haven't owned the technique for varicose vein yet. All right, I'll be very honest. But any others? Yes, acupuncture is great method. I see Goodness in here. Goodness, hi, how are you? You're here again. Just saw you in my clinic today. Okay, scalp acupuncture. I haven't tried you on you, Goodness. On scalp acupuncture, we can try it next time. That because you improving a lot, and we can add more this strategy and see whether it help you even get even further or not. So we have a lot of technique and we test it out. When we got some technique that strategy that tests it out that's good for you, that we keep going, until the result come to here and it can't go any further, then we need to invite something else to come in to make it happen, make it even further. Okay, and sometimes it's not even the techniques issues, it's just you bring the organs, bring your body ability, the function back to here, and it's supposed to be in here, but when it comes to here it just it needs time. Sometimes it needs time. It just stay in here for a while. You just keep going until one day you find, oh, okay, it just bring back to here. Okay, something like that. Things have had other acupuncture treatment. Yeah, Robin. Yeah, this is just one of the acupuncture treatment. I'm gonna show you. I'm not afraid to show you how the needles work. I'm not afraid to show you the needles, how I needle myself, because I think as an acupuncturist, if I'm afraid of needles, you shouldn't come to me. If I can't needle myself, you shouldn't come to me. Because what we treat our practitioners as well when they have when they have headaches, tummy pain, I treat them and I prescribe herbs for them. And a lot of my patients ask me, what if you get sick? Who's going to treat you? I tell them, I treat myself, or my colleague treat me. They needle me, or I needle myself. Because of scalp acupuncture, I really can needle myself. It's just the other acupuncture type of acupuncture, I might not be able to needle me, so I need to needle back. But I tell you, if I have neck pain, I sleep funny, and no one's perfect. I do get sleep funny sometimes, but I haven't been getting neck pain for a long time, because every day I do some acupressure point for myself, and that's what I've been showing you in the previous video. I show you a lot of acupressure point, and I encourage you to do the acupressure point every day. Every day. To be honest, this is how I experience it, and I don't get pain. It's because I do it every day. I have very busy life, and in front of computer a lot of people in front of computer have suffered a lot of pain, but I don't. I don't. Of course, posture is very important as well. Well, yes, we are very much interested in scalp acupuncture, and this is very much appreciated. No problem. Okay, well, I actually have a workshop coming up in May in Malaysia. If you want to join us, yeah, you're welcome to join us. Goodness, good evening, Sunan. Yes, I was back today and always so grateful for the help and progress that you have made to improve my long-term condition that doctor could not help me with. You're amazing. Thank you, goodness. You're so nice and so kind. Yeah, I really hope that everyone get gain your health back. Like goodness has been doing well. We have a long journey to go. So just I'm here to support you, and I want you to commit, make a commitment, to yourself that you want to get better. And yeah, I'm here for you. And weekly acupuncture and daily herbs is gonna help you a lot. Okay, we see a good progress with goodness, and just keep going. All right. So next week I'm going to Christchurch for some fun. To Christchurch Temple, and I'm gonna fly it out on Saturday, and then come back on Monday. Yeah, but while I away, I'm not quite sure I can do the live video at all, but I'll try my best. And yeah, tomorrow is Sunday. We go into temple, and hopefully tomorrow morning I got time to do a live video to say hello to everyone. Okay, I have 2 live videos that I have to present, and it's time for me to go. And thank you very much. So don't need to afraid with scalp acupuncture. So if you would like to try scalp acupuncture, next time you come to clinic, you say, "Wow, Sinan, I want to try scalp acupuncture and see whether scalp acupuncture bring me more benefit and extend the results." All right, I'm happy to do that. Okay, thank you very much. Goodness is a worthwhile journey because the improvement is astounding. Thank you. See you. Bye bye.